mentioned policy. So, what do you think the future holds kind of for that policy piece for us?
Yeah, I think in the last couple of years, there were several improvements in that policy, particularly the NAIL Collab group. We have been invited to provide feedback, for example, to the American Nurse Association policy on artificial intelligence. We also helped the International Council of Nurses to build their own artificial intelligence policy statement, and how can we make sure that these words or how can we protect nurses inside these policy statements are key, because we need to make sure that we have that covered in one way or another in that policy level for them then to be implemented, and making sure that we have our nurses feeling comfortable, feeling protected when they are caring for patients using technology.
What do you think AI will make the most impact in nurses, maybe in like the next year or two?
I believe that I think that is where I push, right? Is to make use of technology to release nurses from mundane tasks, the heavy lift tasks, because I think we have a science. We learn how to build very critical decision making, how to advocate for patients, but we are still spending a lot of time in tasking, and those tasks can be very easily solved by technology. And we have that. And along with that, we also will help nurses to have a more pleasant job, how they can enjoy more, feel that the job is more rewarding, right?
One more thing. What about predictive analytics? Do you think potentially there could be some help there with nurses?
Totally. That is, you let me know when I should stop talking, because that is actually my field, is predictive analytics. And I think there is a lot of room for predictive analytics. The work group, the data science and clinical analytics, the main goal is to foster predictive analytics and predictive analytics skills for nurses to solve nurses' problem. Um, but I always say that predict is easy, right? But how can we actually prevent what you are predicting, right? I want nurses to do that. We can predict falls, but how can you predict who will fall in time that they will not fall anymore, right? That is where we want. And that process will help a lot to improve nursing care, and decrease cost, make patients have better quality of life, that they don't stay longer in the hospital, right? Or don't deteriorate.